Hey everyone, welcome back to my channel Medical Guide. It's Dr. Ida Khan, and in today's video, we'll be continuing the previous lecture of the muscular dystrophies, and this is gonna be the part two of that video. So let's talk about the Becker's muscular dystrophy, which is the second type of the muscular dystrophy. So Becker's muscular dystrophy is the second most common form of muscular dystrophy. It predominantly affects individuals assigned male at birth, although those assigned female at birth may experience milder symptoms. Signs of BMD can emerge at any age between 5 and 60, but they most often begin during the teenage years. The condition's severity differ from person to person, however, it is much less severe than Duchenne muscular dystrophy. The typical symptoms that can occur in the Becker's muscular dystrophy are heart disease, problems with the curvature of the spine, fatigue, problems with thinking, and breathing difficulties. Now let's talk about another type, that is Emery-Dreifuss muscular dystrophy. Emery-Dreifuss muscular dystrophy primarily affects children and young adults assigned male at birth. It typically causes muscle weakness in the shoulders, upper arms, and shins, while also impacting the heart. The progression of EDMD is generally slow. Usually, the muscle contractures, that is, shortening of the muscle, appear before the muscle weakness appears. Now, let's talk about limb girdle muscular dystrophies. Limb girdle muscular dystrophy targets the muscles in the shoulders, hips, upper arms, and upper legs. It can affect individuals of any age, with around 2 in 100,000 people in the United States living with this condition. Symptoms usually start to appear in childhood or early adulthood. Muscle weakness starts in the pelvic area and moves to the shoulders and other body parts. Now let's move on to another type of the muscular dystrophy, that is facioscapulohumeral muscular dystrophy. It is also referred to as Landausi-Digerin muscular dystrophy. Now here in this muscular dystrophy, it primarily affects the muscles of the face, shoulders, and upper arms. Symptoms typically begin before the age of 20, and approximately 4 in 100,000 people in the United States are affected by this condition. There can be seen a sign which is known as polyhill sign, where there is an extra hill over the biceps muscles. There is difficulty in lifting arms, whistling, and closing eyes. It mainly affects upper body and can also cause hearing loss, speech problems, and changes in heart rhythm. Now let's talk about oculopharyngeal muscular dystrophy. Oculopharyngeal muscular dystrophy affects the muscles in the eyelids and throat. Symptoms including drooping eyelids, that is ptosis, and difficulty swallowing, that is dysphagia, typically begin in the 40s or 50s. Approximately 1 in 100,000 people are affected by OPMD. This condition also causes tongue and facial muscle weakness. Now let's move on to another condition, that is distal muscular dystrophy. Distal muscular dystrophy primarily affects the muscles in the hands, feet, lower arms, and lower legs. Weakness in the ankles makes it difficult to walk. This condition typically develops in individuals between their 40s and 60s. Now let's talk about another type, that is mitochondrial myopathies. This condition is caused by reduced levels of functional tRNA that are required in the mitochondrial protein synthesis. So the symptoms are typical symptoms plus heart problems, seizures, and problems with vision and hearing are prominent. Now the last type that we are going to discuss is myotonic muscular dystrophy. Myotonic dystrophy is the most frequently diagnosed type of muscular dystrophy in adulthood, affecting adults assigned male at birth and assigned female at birth equally. Individuals with this condition often struggle to relax their muscles after activity. It can also impact the heart and lungs and lead to endocrine complications including thyroid disorders and diabetes. Usually, it does not start to produce symptoms until after the age of 20. Some people don't have symptoms until as late as age 50. Now, following are the tables describing important features of each condition. Now let's talk about investigation. In addition to a medical history review and physical examination, your doctor may suggest some of the following tests. Number 1, creatinine kinase blood test. A creatinine kinase blood test measures the level of creatinine kinase, an enzyme released by muscles when they are damaged. Elevated levels of creatinine kinase can indicate muscle damage, which may be a sign of muscular dystrophy. Electromyography. This test involves inserting an electrode needle through your skin and into the muscle to be tested. Electrical activity is measured as you relax and as you gently tighten the muscle. Changes in the pattern of the electrical activity can confirm a muscle disease. Then we have muscle biopsy. A small piece of muscle can be removed through a small incision or with a hollow needle. The analysis of sample can distinguish muscular dystrophies from other muscle diseases. And then finally, genetic testing. Blood samples can be examined for mutations in some of the genes that cause different types of muscular dystrophy. Now let's dive into its treatment. Currently, there is no cure for muscular dystrophy, though research is ongoing to find one. The primary focus of treatment is managing symptoms and improving the quality of life. Treatment options can vary depending on the specific type of muscular dystrophy and may include physical and occupational therapies. These therapies aim to strengthen and stretch muscles, helping maintain movement and function. Corticosteroids, medications like prednisolone and deflazacort may help delay muscle weakness, improve lung function, slow scoliosis progression, reduce cardiomyopathy progression, and extend survival. Mobility aids, devices such as canes, braces, walkers, and wheelchairs can enhance mobility and reduce the risk of falls. Now, surgery. Surgical procedures may be necessary to relieve muscle tension, correct spine curvature such as scoliosis, or address other complications. Heart care. Early treatment with AC inhibitors and or beta blockers can slow cardiomyopathy progression and prevent heart failure. Pacemakers can also be used to address heart rhythm problems. Speech therapy. For individuals who have difficulty swallowing, speech therapy can provide assistance. Then respiratory care. Cough assist devices and respirators can aid in breathing, and in severe cases, tracheostomy and assisted ventilation may be required. Medications. Recent drugs like eteplirsen and golodirsen are designed to alter the course of certain forms of muscular dystrophy, such as Duchenne muscular dystrophy. While there is no cure, these treatments help manage the condition and improve patients' daily functioning. As tight scar tissue can lead to significant loss of range of motion, therefore, stretching is performed to prevent scar tissue formation. Thus, a stretching program should begin early in treatment. Let the child be in charge of stretch, and if child resists strongly, then employ another method. Passive stretching must be done daily and can be best augmented by standing. How long to hold the stretch remains a debatable point, as there is very little research evidence. However, we do know that the longer a young man can hold the stretch, the better, as a prolonged stretch permits the muscle spindle to habituate to new length and allows the lengthening reaction to occur. Now, adjuvant therapy. Adjuvant therapy refers to additional treatment given after the primary treatment, such as surgery, to reduce the risk of disease recurrence. In the context of muscular dystrophies, adjuvant therapy refers to supportive treatments aimed at managing symptoms, slowing disease progression, and improving the quality of life. Because respiratory infections may become a problem in later stages of muscular dystrophy, it's important to be vaccinated for pneumonia and to keep up to date with influenza shots. Coping and support. For the family members of such patients, coping with the illness involves major commitment of physical, emotional, and financial resources. Now let's talk about prevention. Since muscular dystrophy is a genetic condition, there is currently no way to prevent it. However, if you are concerned about the risk of passing it on to a biological child, you can speak with a healthcare provider about genetic counseling. In some cases, prenatal testing may help diagnose the condition early in pregnancy. For individuals with muscular dystrophy, there are steps you can take to prevent or delay complications and improve your quality of life, such as eating a healthy diet to prevent malnutrition, drinking plenty of water to stay hydrated and avoid constipation, exercising as recommended by your healthcare team, maintaining a healthy weight, quitting smoking to protect lung and heart health, keeping up to date with vaccinations. And lastly, now let's talk about prognosis. The prognosis for muscular dystrophy varies depending on the type and individual circumstances. Your healthcare provider can offer a more accurate outlook based on the specific type of muscular dystrophy you have and your unique condition. Some cases may be mild and progress very slowly over a normal lifespan, while others produce severe muscle weakness, functional disability, and loss of ability of walk. Some children with muscular dystrophy die in infancy, while others live into adulthood with only moderate disability. The muscles affected vary, but they can be found around the pelvis, shoulder, face, or elsewhere. Muscular dystrophy can affect adults, but the more severe forms tend to occur in early childhood. And that's all for today's video. I hope you learned something from it. And if you enjoyed this video, like, share, and subscribe to my channel. So, see you later. Thanks for watching.